I'm a heart failure advanced practice nurse, and I would like to talk with you just for a few minutes about heart failure. I am passionate about educating patients about their heart failure, and your doctor and nurse will be talking with you at length about all the specifics of your specific kind of heart failure. My goal is just to simplify the overview of some of the most important parts of living with heart failure. So let's get started. There are basically two kinds of heart failure. The first kind is systolic heart failure, and the way systolic heart failure works is every single time your heart beats, it's supposed to eject out about 60 to 80% of the contents of the left ventricle. In patients who have systolic heart failure, you're not ejecting out all the blood you're supposed to. In fact, a lot of patients with systolic heart failure have what we call an ejection fraction less than 40%. Ejection fraction just means every single time that left ventricle contracts, it's supposed to squeeze out the blood in that left ventricle so that it can bring it around to the rest of the organs in the body and deliver oxygen and nutrients. Only in patients with systolic heart failure, they have a weakened heart muscle, and that pump is not pumping like it's supposed to. The other kind of heart failure is called diastolic heart failure, and it isn't a pump problem per se. The problem is that you have really stiff ventricles, where your ventricles are like, oh, and they have a really hard time just getting the blood into the ventricle. It's not really a problem ejecting it out if we could get the blood in. So it'll be important for you to ask your doctor, do I have diastolic heart failure with the really stiff ventricles, or do I have systolic heart failure with the really weak pump with a reduced ejection fraction? Remember, ejection fraction is just the amount of blood that we eject out with every single heartbeat that gets circulated around the body. Normal ejection fraction is 60% or better. People with a systolic heart failure with a reduced ejection fraction, usually it's less than 40%, but it'll be important to ask your doctor, what's my ejection fraction? So those are the two types, but regardless of whether you have systolic or diastolic heart failure, you end up with a very similar problem, and I like to think of that as a forward problem and a backward problem. The forward problem is that every single time your heart is supposed to be delivering all of that blood with every beat, with all those oxygen and nutrients, because you have that weak heart muscle that isn't doing a very good job, you're not getting all those oxygen and nutrients to all of your body. And a lot of patients that have heart failure feel so fatigued. You know, like all the things you used to do that you just, heck, going to your mailbox or getting up to cook dinner or just simple things. And you used to could do them and you didn't get short of breath. Well, patients with heart failure will end up feeling so short of breath and fatigued because their pump is, their little weak heart muscle is not doing a very good job, and they end up feeling so tired. I don't know if that's ever happened to you, but that's what a lot of patients feel, and that's that forward problem of heart failure. The backward problem is whenever, if your little weak heart muscle is not doing a good job pumping all the blood around, it has a tendency to back up, especially when we eat a lot of salt, or if we forget to take our medications, or we get too much fluid on board, any number of reasons. But because that weak heart muscle is not doing a good job pumping the blood, it'll back up, and you can end up with edema, fluid, in your feet and in your ankles, and sometimes in your belly, and sometimes it ends up in your lungs, where you get really short of breath and you almost feel like you're coughing up something. So I don't know if that's ever happened to you. We call that, when the fluid gets in the lungs, we call that pulmonary edema. And a lot of patients that end up in the hospital end up with fluid overload, where they have so much fluid that it's in their lungs now. So that's the forward problem, where you feel really tired and fatigued, and the backward problem, where the fluid builds up. So it'll be important to ask your doctor which kind of heart failure you have, and understand that either one will give you the forward problem and the backward problem. There are a number of things that heart failure patients need to do to have the best possible quality of life. And I would like to prioritize a few of those for you to focus on. The first and foremost is to take your amazing heart failure medications. I like to call them amazing because unlike a lot of illnesses, at least with heart failure, we have a lot of generic, and some of them $4 medications that can really slow the progression of the illness. The specific kinds of drugs that do that are called ACE inhibitors and ARBs. And if you don't have any contraindications, your doctor may place you on one of those drugs. And let me tell you how those drugs work. So you have your little weak heart muscle trying so hard to do a good job for you, pumping, right? Only he's not doing a very good job because you have heart failure. So you have your heart up here and you have your kidneys down here. Well, your kidneys are rather selfish. They expect a whopping 25% of your blood flow all the time. But unfortunately, because you have heart failure, your heart's not doing a very good job giving them all the blood they want. So those darn kidneys get mad and they release this chemical. Now, we know that chemical as healthcare professionals is something called angiotensin II. But I think some of the most important things for you to understand is that that chemical is one of